Hi, it's Dr. Maggie Perry with Tell Me What You're Proud of. Today, I have on the show Larisa, and we'll be talking about preparing for the anxious moment. So, Larisa, thanks so much for joining.
Oh, I'm glad to be here. Thank you.
Yeah, you're welcome. So, why don't we just jump right into the topic? Are there moments that in your daily life or your weekly life that you notice that you get anxious?
Oh, yeah. Yes. I feel like I'm learning to recognize my anxiety a lot better. And so I think I'm dealing with it more effectively, but I still get really anxious. And dealing with COVID has probably been one of the biggest things of my anxiety. But I know that I recognize now that I had a lot of anxiety way prior to COVID, the pandemic. But that, because I think we were so, everything stopped, all the things that I did day to day, like a lot of activities, volunteering and out and about, going to the gym, everything abruptly stopped. And I was kind of amazed at the amount of anxiety I felt, partly because of COVID, and I think just because of the whole change in my schedule, and
Yeah, that completely makes sense. So, actually, give us a little bit of a sense of who you are. So, well, who you are in and from the perspective of anxiety. So, when you say that there was anxiety prior to COVID, prior to the pandemic, what kind of anxieties would you experience?
well, I think a lot of health related things, worry about my health or my husband's health. And my husband has had some pretty serious health events over the last, since 2018. And so, although I think I've dealt with each one of those things and dealt with my own, I mean, I feel healthy, but the fear of future events, fear of getting something, and what would we do? That I think really intensified over when COVID hit. But any event that my husband had, I think I dealt with it really well. But nevertheless, I think the uncertainty of what that could lead to, because we're both, in his 70s, I'm 67, and I never actually, I never really used to worry about that too much, because I really felt like I'd go to the gym. I did a whole lot of things that could keep me healthy. But I think underlying there was a lot of anxiety, and anxiety too about, well, anything that was out of my control almost, if I wasn't sure what people thought of me, and especially if it was somebody I really cared about, it was really very difficult to, that caused a lot of intrusive thinking, wondering what are they thinking, do they like me? If I had any kind of, well, like when I was in school, when I was in school as a nursing student, or when I was teaching at part-time at community college, I mean, I would over prepare, and I'd think of all the worst case scenarios that could happen, and so it was never enough, and I was a good student, and as far as I enjoyed teaching, but if it was anything, speaking in front of a group, I got a lot more comfortable with it, but it brought up a lot of anxiety, kind of like not quite good enough, or you're going to blow it some way or another, things like that.
Mm-hmm. Yeah, so I'm hearing you talk about a lot of different types of worry and intrusive thinking kind of
Mhm.
across the spectrum. So would you say that it was all about uncertainty, like the feeling of uncertainty or loss of control in whatever area of your life, whether that's health or academics or work, social situations, I guess now more health stuff.
Yeah,
It's like the feeling of uncertainty that causes you
yeah,
a lot of anxiety.
the uncertainty of it, yeah. And would I do something that would inadvertently hurt me or hurt someone else, because I missed out something. Like when I did nursing or when I was working with students, what I overlooked to teach them something, and then what if they made a mistake, and as a result, I was always worried that I'd miss something and it would have a bad effect.
So
I wasn't always like that, but that that definitely was present some of the time.
yeah, so the theme was responsibility or over
Yeah,
responsibility.
yeah.
It's really prominent for you.
Mm-hmm.
And so now, as you notice those themes, that anything related to the feeling of uncertainty or the possibility of responsibility is potentially going to be a trigger, what do you do to prepare for when you're going to be anxious?
Okay. Well, one thing I really do is I try to recognize some of the signals, like if it starts with what if, like what if this happens, what if that, I I right away I try to kind of step back from my thoughts, say, okay, this is really I'm recognizing this is my anxiety or this is my OCD, and I try to do practice being mindful, like what am I doing right now? Whatever's in the future is going to have to, play itself out in the future. There's no way of knowing what will happen down the road. And how am I, and try to just put it back to what I'm doing right now. And and with COVID, I've gotten to where, I look at the science, if I had a scratchy throat, oh gosh, all of a sudden I thought, could it be COVID? Oh dear, am I a carrier? And it would just start all of that. And I'm very grateful for COVID. I'm very grateful for Huddle because I didn't recognize that was my OCD, and that was my anxiety. I was thinking, well, if I'm thinking it, there must be some truth in it, or I wouldn't be thinking it. And then I'd get like sensitized and have the anxiety, and it would just start that whole loop. And I think another thing that's helping me is.
Do you mind if I actually interrupt you there? Can you hold the thought you're having?
Not at
Yeah.
all.
So I just want to mirror back to you what you're saying, because you're hitting on a lot of really great points. So one of the things you're saying is getting distant from thoughts. So you've learned to see a thought as a thought, that a thought is just a thought. It's not a message, threat, or prediction. And that's a really big shift from what you just said, that you had the belief before, like if I'm having a thought, there must be something important about it. And I wouldn't be thinking about it if it wasn't truth or it wasn't important. So that shift from, if I have a thought, it must mean something and I must pay attention to it, to thoughts are just thoughts. They can intrude kind of against my will. I don't have control over what arrives in my mind. And it's okay to get distance from or let thoughts go. That's a huge shift in your relationship with your mind. And then what you were also talking about is, after noticing that you're having a thought and it's arriving with sensations, it's arriving with a whoosh, then you can bring yourself back to the present moment. So you don't have to go off into the future or into the past just because of the sensations you're feeling as you're having that thought, but you try to focus on the present. So that was just great. Thank you or I'm happy to hear that you're using those skills. Was there something else you were going to say that you now do?
Gosh, I can't remember now. But
sorry for cutting you off.
But oh no, I know. That is okay. Is this a problem? I try to figure, is this a problem to solve? And if it is a problem to solve, is it something that is urgent? Is it emergency? Well, if it's not an emergency, I can take a deep breath, give myself time to process it, and I recognize too, though, that even if I'm still having those anxious feelings or my face gets flushed and hot, it still is not it's a signal. I guess that's what you call it. Learning the language around OCD and anxiety is really helpful to me now, and also more than learning it is then I know how to apply it. And so recognizing that even if I'm still feeling the anxiety, it doesn't mean that it's true, and I'm going to get through it. And that's just that's just a part of me, and that may, hopefully, it may be there at times, ongoing for a long time, but I really feel I'm getting a handle on recognizing it and how to deal with it, and know that
Yeah.
it may come back, but I'll be able to get through it.
Yeah, that's actually just what I wanted to comment on, that there's two types of acceptance is important for your anxiety disorder. There's acceptance of the anxious thoughts, feelings, and sensations in the present moment, but there's also acceptance of the disorder overall, and the realization that anxiety disorders and OCD are chronic intermittent conditions that typically peak and pass throughout people's lives, but definitely come back at different times when you're sensitized. And so the thinking there, as we've talked about before, is that anxiety disorders are genetic conditions that are also informed by nurture, or like in the environment that you grow up in. And so it's often that having kind of a sticky mind runs in families, and is like if one of your parents was a worrier, or one of your parents had unwanted intrusive thoughts and compulsive behaviors in response, then you not only get kind of that sticky mind from them, but you also kind of learn their behaviors as you're growing up, making it more likely for you to have beliefs like, if I have a thought, then I better pay attention to it. And that is going to then be more likely for you to have an anxiety disorder as you grow up. So the concept of accepting that you have an anxiety disorder is kind of based in this awareness that there is a genetic component to it. And so when your body is under stress, or what we call sensitized, you're likely to get a sticky mind again. And then you might have new content or themes, like you might be worried about something different, but the same processes are likely to occur again. So it sounds like you've done a really good job in preparing for the anxious moment. You first have to accept that anxiety is a possibility for you and that it might come back. So you have to know your triggers, because you have to accept that it might come back. So do you want to say anything about that? Has that been part of your journey at all, to like accept that you have an anxiety disorder?
Yes, actually, and the OCD part, I always initially, like, when I started thinking, talking more about the OCD and having it before Huddle, mainly with my one sister-in-law. She was so helpful in that area, but I always thought of it as something that it has to be an outward behavior. One of my outward behaviors is that if I'm anxious, I jog. I jog in the house, I'll jog around. But other than that, I thought, well, I never really understood that intrusive thinking is a big part of it too. It's not just what the outward behavior is, the internal, and that has been a huge help. And there was a time when, even when I was beginning to think, well, okay, I have OCD, I always wanted to negate the thought that it could be a genetic component. It was like, oh, well, it was something in my environment, or it had to be related to trauma, or whatever the stress was in my life at the time. But now I realize that it can be that and both. It can be both, and that's been really freeing to accept that and not see it as a fault or like a flaw. And actually, I'd say since I've been going to Huddle and being able to talk about it, and as I understand it and hear other people, like on the both on the podcast and in the blog, but hearing the others in the groups talk, and I almost look forward to it, because there's a feeling of like you're not alone, and hearing other people's success or struggles, it's really helped a lot.
And it sounds like, so has it specifically helped you accept your anxiety disorder, in addition to making you feel better about it? So yeah, do you want to comment at all more on what is it helping you with in terms of your process?
It's helping me not to be afraid to, even, well, when I recognize it's my anxiety, I think it's helping me to have more of a voice, like be able to speak what's on my mind, even if I get anxious. Like I think because the anxiety in the past caused me to avoid certain situations, especially if I thought there would be that I'd be uncomfortable. I avoided them altogether. I avoided anything that would be a uncomfortable conversation, if at all possible. And just of recent, I think it's been more in the last month or two. I find more and more that that I'm able to speak what's really on my mind, and not only am I able to do it, but it's important to do it. It's important for my relationships. It helps me gain confidence about myself. And I think it's also helping me to be more compassionate with myself, and not so hard on myself, that I don't have to agree with everything. I don't have to, if somebody doesn't like something, it really is okay. I might not feel good about it, but unless I'm doing something that really is harmful or adverse to my character, I don't have to worry if it's not the same thinking as someone else.
Yeah, it absolutely makes sense. And, conflict avoidance is a really great example of a subtle way that those that suffer from anxiety often avoid, but don't notice it as part of their anxiety disorder. They might think it's part of their character, personality, or they don't even really notice that they're avoiding conflict because they're so used to it. But so everybody with an anxiety disorder avoids, but not everybody avoids behaviorally. And since a lot of people with anxiety disorders have a lot of perfectionism too, they'll kind of white knuckle their way through situations. So like you used the example before with work, rather than behaviorally avoiding work, you might over prepare and get reassurance. And the way that the avoidance was probably of the feeling of uncertainty. So over preparation, getting reassurance from other people, checking and rechecking your work, those are all avoidances of the feeling of uncertainty that actually make the feeling of uncertainty more likely. And conflict avoidance is also avoidance of uncertainty, but can also be kind of the avoidance of the feeling of anger, if that's relevant, or any other kind of feeling that a potential unexpected social experience might trigger. So it's, that's just a really subtle avoidance, but can totally tie into both generalized anxiety and OCD. Do you have thoughts about how there's like many different types of avoidances and they're kind of sneaky and subtle?
Yeah, I mean, they I'm trying to think of an example. Well, I don't know if this is the answer to your question, but I'm trying to look more at like when I do get anxious and I want to like avoid a conversation about with my husband or with a family member. I'm starting to something you said just recently, that I'm trying to look at what other feelings might be going on inside also. Am I feeling frustrated, angry, maybe kind of scared and alone, or sad? And I think especially sadness and stuff like that have been hard for me to recognize when they're there. The anxiety is always the prevalent part. And so you've talked a lot also about looking at our core beliefs. And so I'm trying to look at that too, without like, going too deep and trying to analyze and figure out, because I know that that's part of my OCD too. I think I try so hard to figure out in the past, why did I say that? Why did I do that? Or that I would, it would replay in my mind. So I'm not trying to do that, but more trying to just look at what would cause me to feel this way, and not feel comfortable with who I am, just as I am, if that makes sense.
Yeah, it's a great example of when you start to self-observe and self-monitor, and you're looking for triggers. You at first maybe you just start to look at anxiety. So you look at like, what was the trigger? What was my anxious thought? What was my anxious sensation? Or what sensations did I have? What feelings did I have? What did I do in response? But once you start kind of getting in the habit of doing that, then you can look at what all kinds of different feelings you might be having, and just like you're saying, kind of have the habit of self-awareness, so that when you do notice yourself doing something that's not consistent with values, or you're thinking that you might do something that's not consistent with your values, you can stop and reflect on it. Is that what you mean?
Yes, yeah, definitely. And that I think is happening a lot more. That I'm just recognizing, okay, oops, here we go again, and just kind of taking a deep breath, um, and it doesn't. I mean, depending on the severity and depending on the situation, it doesn't overwhelm me like it used to. That I guess I'm getting more comfortable maybe with living up with uncertainty, that I can't have all the answers. I don't need to have all the answers. And that possibly when I'm doing that, I'm not being in the moment. So I really, I try to do things that, especially since COVID, I've really tried to, but prior to that, do things that will help me to stay in the moment, like meditate, especially too when my anxiety is really high. Then sometimes I'm learning to kind of know the difference of when do I just have to be still and let this pass, and even just sit and meditate, as hard as it would be, or just be mindful, or maybe when is it good to do a different thing and sort of take my mind off of it, not so much to avoid it, but not let the anxiety consume me so that I almost feel paralyzed. So.
Yeah. How do you make that? That's a great differential. How do you think through whether to stay with an anxious experience, or to redirect your attention away from it?
Well, if I have that feeling that I want to jog in the house, I know I better just stay with what I'm doing, you know. But then sometimes I will. I'm trying to think. Sometimes I'll feel uneasy, and so I'm doing all these things around the house to kind of distract my attention, but the intrusive thoughts keeps coming back, and that's maybe a time when I say, you know what? Rather than trying to keep cleaning or make the kitchen perfect, maybe I need to just go outside and work in the garden, because that's something that it just puts me back in the moment. And I initially, when at the very beginning of the pandemic, when it was, there was just so much uncertainty. There was so many, well, still a lot of information, and you don't know what's true, what's not true. Being in the garden, working in the garden, getting my hands dirty, it just put me in the moment, and it took away that urgency, like I should be out, I got to go run, or I've got to. It was kind of a peaceful way of being active.
Yeah, that sounds really great. And just to frame that up for other people too, which is exactly what you're describing, the differential is kind of what's harder, but not to be mean to yourself about what's harder. So what you're saying is, like, when I have the urge to run in the house, that's when I stay still. You're doing
Mm-hmm.
the opposite. So you're doing the harder thing. When I have the urge to clean the kitchen, I step away from the kitchen. That's also doing the harder thing. Either jogging in the house or continuing to clean would both be the compulsive behaviors that are like kind of going with the anxiety. And you want to notice the anxiety, allow it to be there, but do the opposite of what would keep it going. So that differential is really great. Sometimes that means, don't just sit there, don't just do something, sit there, But other times that means, get up and go for a walk or go in the garden or something like that. Because if you just stay in it, you're likely to start to dwell in a way that's not helpful.
Right. I'm laughing a little bit to myself because even today, it's like 4 o'clock couldn't get here soon enough. It was like, and so I prepared, and I found like I was getting nervous this morning because this morning we were, getting Christmas gifts online for our grandkids and our nieces and nephews, and I kept thinking, oh, I should be preparing for the talk. I should be preparing for the talk. This was like 9:30 this morning, and I mean, I had already I'd gone over a lot, with what you had said to the things that helped me to relate effectively, anxious moments, times when I was anxious effectively, and sometimes that I wasn't. But my mind kept going to the future, and then like my husband played golf, and I thought, oh gosh, he's going to be gone, and I've got to do this podcast all by myself. And I mean, it was silly because he wouldn't be in here anyways. But so what I know that sounds crazy, but
No.
what I did, so I could laugh at it, and then I at one point I just purposely went on a bike ride because I thought, and I went on the bike ride like right at around 2:45, not a long bike ride because I thought I can't go on a bike ride. What if something happens to me? And I did get in a bad bike fall earlier this week, swerving to get out of the way from another cyclist. And I found myself feeling like afraid to get back on my bike. And I thought, no, I'm going to do it. And I'll, I had a thought, well, what if I got in an accident and then I'd be late for Huddle. So I made myself take a bike ride in the neighborhood. And so that I felt like was a good example, was a time when I wasn't riding my bike because I was anxious. It was more that I needed to trust the fact that I'm prepared enough. I could go take a bike ride and enjoy it. And it doesn't have to be a long bike ride, but just to do something different.
Yeah, well, and my reaction is that I really appreciate your attitude in that your anxiety really jumps around. Like it can really give you a lot of different what ifs about a variety of different things throughout any given day. So it seems like you maintain a really good attitude where you think like, oh, I'm doing a what if again. Here's my chance. Now let me go do something that would challenge my anxiety. Is that attitude easy for you to maintain? Or can you speak to that as we finish up the session here?
You know what? I think it's getting easier and easier all the time. It really is. And I think sometimes I'm also learning that just some things are out of my control. Some things are going to play themselves out in time. And one thing, I was listening to your podcast, your most recent podcast, and I think it was with Danielle. Anyways, she mentioned about traveling, and that's something I've wanted to do. Anyways, she talked about, but I have fears around it, and but she talked about that one. Don't overestimate your risks and don't underestimate your ability. And I remember when I had heard the first podcast that I think it might have been Reed Wilson, I'm not sure who it was that said that. It really hit me because I think that that's easy for me to do. I build it up, I catastrophize what the risks are. And I think that's why in the past I avoided a lot more. But I'm learning to not overestimate it and not and to recognize my ability to handle a situation. And that really helped me so much when I first heard it. So when I heard it yesterday on the when she was talking about traveling and everything, it kind of refreshed it in my mind. And I do think that that's happening. It's kind of up and down, but it's up and down, but I think it's a continual movement upward, forward in a positive way.
Yes, I'm really happy to hear that. And I think in summary, I just want to reinforce all the skills that you described in terms of preparing, what you do to prepare for the anxious moment, that you know what you're willing to self-observe. So you're willing to find what your triggers are. You're looking for your avoidances. When it's happening, you're getting distance from the anxious thoughts and surrendering in the present moment to the anxious sensations. And then this belief that you're developing that regardless of what I'm feeling, I can handle it. And I'm not going to overestimate risk and underestimate myself. Rather, I'm going to underestimate the risk or try to see the risk for what it is, try to see the anxious thoughts for what they are, and believe that I can handle it. And I think you're on your way to overcoming anxiety. So I'm looking forward to talking more. Thanks for your time.
Okay, Maggie. All right. Thank you.